Hi everybody, welcome to my humble abode. If you've watched my channel before, you know that I always talk about my vitrectomy surgery, my eyes, my glaucoma, my cataracts. Today I'm doing a new video. This is going to be about my gallbladder situation. So 7 years ago, I started getting a twinge of pain under the right rib. I took Tums, antacids, I took omeprazole, which was prescribed to me by my gastro doctor, and it didn't do anything. The next year, I started double dosing the omeprazole. And I went to see my gastro, and they sent me for an ultrasound, and they said everything looked fine. So I was like, what could this be? I had lung surgery in 2017. I thought maybe something from that. Who knows? Because they did go in on the right side. So I kind of like blew it off. And years later, more problems, acid reflux, GERD. I started getting all kinds of stomach problems, which I still have. And more recently, within the last 2 or 3 years, I've been getting these attacks where I'm doubled over in pain, sweating, spike of fever, and then the next day I'm all right. Back pain, shoulder pain, pain in the shoulder blade that goes down and around to my rib. So I kept pushing. I kept going to the gastro, and I was like, I have this pain. I had one doctor that was covering that just like pressed so hard on my stomach, I thought she was gonna push through my spine. But she never sent me for any tests. She just said, oh, it's probably your IBD, which is irritable bowel disease, which they have all types of irritable bowel disease, or called IBS, where you can have IBS constipation, IBS diarrhea, IBS-M, which is mixed, meaning you get both. So the doctor was blaming it on that, said go to gastro. Everybody passes the buck back and forth. And what happens is I just keep going, and I get more ultrasounds, or I get more CAT scans. And the latest from 2025, I had an ultrasound. It showed that I had a cyst on my liver, and that I had a fatty liver. So they were like, watch the alcohol. I'm like, I can't even drink alcohol at this point because I'm in pain whenever I drink something carbonated. I have a hiatal hernia, so that irritates me. I have an umbilical hernia. I get a stomach ache. If I eat something too spicy, more problems. I went for a CAT scan. The CAT scan showed that I have a cyst on my kidneys. I've had kidney disease in the past, and you know, it just was never answering the question about the pain under my right rib that would radiate. And you know, I tried to ignore it until I really started having more of these like painful attacks in the middle of the night. Like I'm trying to sleep. This is my cat Trey, by the way. He's popping in for the video. And you know, the pain just kept getting worse and worse. The attacks were getting worse and worse. I would lay in my bed at night thinking, I got to get to the emergency room. Like, I'm going to wake my husband up and we're going to go to the ER. I didn't want to do that. I did go to the ER over the summer. I was having like very bad dizzy spells, very bad migraine. My blood pressure, which is always 90 over 60, 110 over 70, shot up to 166 over 92. And the emergency room doctors were saying, we can't treat you for high blood pressure. We can only treat you for your headache and your dizziness. And I said, well, I've never had this kind of high blood pressure. Like, what's going on? And they said a stroke or a heart attack is 180. And I was only 166. So I was like, well, I'm 14 points away from a stroke or a heart attack. And they were like, have you ever had a stroke? I said, not yet. But they ended up just giving me Benadryl and some kind of Tylenol, liquid Tylenol in the IV. and antivert and sent me on my way. And I didn't have any more blood pressure spikes, but I kept getting that annoying pain under my right rib. So don't ignore annoying pain under your right rib. So I continued on. I saw my gastro, told her what was going on. She said, start taking your omeprazole again. I said, fine. And I said, these people are just blowing me off. But I have really good primary care. My gastro's great. So I'm not knocking them. It's just they were treating what they thought was just me complaining, I think. Finally, I said, I got to see my gastro again. And unfortunately, she had a family emergency and she was out of the office for 4 months. So in that time, I was just getting worse and worse. Finally, she got back and I said, listen, is there any other scan you can send me for? And she said, yes, a HIDA scan. That's HIDA scan. So I go for the HIDA scan. And what they do is they inject you with a medication that forces your gallbladder to contract and squeeze out, do its job, bile, which goes down into your intestines. So in 30 minutes, they were like, okay, you're done. And I'm thinking, did they find gallstones? What did they find? Turns out they said that my ejection fraction was at 8%. In 30 minutes, your ejection fraction, which is your gallbladder contracting, it needs to be around 40% for the normal people out there. And I'm at 8%. So they said that was abnormally low and I need my gallbladder out. So now I go back to the gastro and I say, HIDA scan says that I have abnormal ejection fraction. And she said, yes, it's very low. We're going to send you to the surgeon. So she sends me to a very good surgeon with a bedside manner who does these surgeries all the time. No fear, no worries, just see this doctor. Well, this doctor's so popular, I had to wait 2 more months. So I've had 2 more months of attacks. I finally saw him, and they're going to take my gallbladder out in early 2026. And I am going to update all of you because when I looked on YouTube, I could only find a handful of people, patients, explaining the procedure, how it went, what their recovery was like. And all the other videos were doctors and nurses telling you about this simple procedure, which is actually considered major surgery. The doctors said they're going to do robotic, they're going to try to do laparoscopic, and if they cannot do it, then it will be a full-on old school, cut you with 6 inches and, you know, open this up and get the gallbladder out. I do have the 2 hernias. He may try to repair them when he's in there. I cannot be out for a long time because I have bradycardia and I have a lot of other health issues. So I am going to be back again, friends, with updates regarding the gallbladder. So if any of you are having this kind of issue, you will see it firsthand. I mean, you know, I may not do a video when I first wake up from my surgery, but I will definitely be letting you know how it goes. The recovery could be anywhere from 4 weeks to 8 weeks. They said you have to get up and walk every day, just a little bit, you know, and I heard that you have to sleep on your back. I'm a side sleeper. Sleep on your back, sit propped up, because you know, it's your stomach muscles, really. They're going to go through the belly button for the robotic. We're hoping they can do that. And I'm hoping I'm going to be back in action and able to eat whatever I want without doubling over in pain. And I'm going to keep you all posted. So thanks for coming to my humble abode.